In this video today, we're going to talk about pain after hernia surgery and explaining the next steps for pain relief. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician who helps patients understand their options, specifically their options for pain relief, whether it's physical or whether it's mental, and how to be able to treat it without always the same standard fare. The things that we do on this channel is provide a scientific basis for understanding what are the options, how do they weigh with a risk-benefit analysis, and whether it might be the right thing for you. Today, we're talking about hernia surgery, and we are really specifically talking about how frequently it occurs and what are some of the traditional treatments, as well as a relatively newer type of treatment that can be able to provide relief that's different and can last longer than traditional techniques. So we talk about hernia. The thing that we need to have is kind of a common language of vernacular. In essence, a hernia surgery is normally dealt with when there's a defect that's present within the aspect of a wall where traditionally tissues like the bowel or loop of intestine or other structures should not be. And so that defect or opening is repaired through different mechanisms. Traditionally, nowadays, it's done in a laparoscopic fashion, meaning with using cameras, either through the element of the surgeon doing it directly or through using a robot to be able to kind of place and treat that defect that exists. As we know, hernia surgery is a pretty common surgery. What is sometimes not very well known is the frequency of chronic post-surgical pain afterwards. And what we see is when we compare it to a number of other surgeries that are out there, is that it's a pretty common occurrence that pain lasts longer than 2 months. And that's about 14 or 15%. So a little bit more than a little bit more frequently than 1 out of every 15 patients has some type of pain of this ilk, right? So when we think about this, we're like, man, that's not all that uncommon. I mean, if the surgeon told you this ahead of time, you'd say, well, maybe there's some things that we need to do to try to see if we can ward this off. And there's a paper that looks at that specifically, that looks at the transition from acute to chronic and says, what can we do to be able to treat this before it happens? So there are ways to be able to look at, can we use different types of treatment techniques where there's oral medications or regional anesthesia or treatments post-operatively to try to be able to provide relief. The further element of this is looking at things like risk factors, whether it's a younger age or gender, and saying, hey, we're high risk, so we need to do something about it. Let's use medications up front. Let's use some things during the surgery. Let's use some things after the surgery to prevent this from occurring. So who is higher risk? Well, the following is where we see higher risk. Gender can play a role. Age can play a role. Whether someone has pain that is severe initially postoperatively, if you happen to have chronic pain that's present prior to the surgery, it certainly can be a problem and an issue. And so some of those things, in addition to how the surgery is done, if it's an open surgery, it can also result in having a higher likelihood of pain. One paper that looks at a different type of way to be able to kind of treat this is the following, is neuromodulation of the dorsal root ganglion for chronic post-surgical pain. I know that's quite the mouthful, but at the end of the day, really what we're talking about is a different type of treatment than traditional. So some traditional treatments are the following, things like nerve blocks, oral medications, certain type of nerve pain medicines that you can take orally, peripheral stimulation, and surgical revision. The downside behind most of these are, though they may give relief in the immediacy and kind of short term, they don't frequently provide a sustainable degree of relief that can be utilized long term. We talk about surgery as being the gold standard. So we did hernia surgery and we got pain. So maybe we should need to do some more surgery to see if we can be able to fix it. Well, probably not. So what we see is that there's a type of treatment for the general femoral, ilioinguinal, and iliohypogastric nerves. I know that's kind of easy for me to say, but in essence, it's the nerves that enter around that area, and try and see if we can improve it. The problem is those techniques haven't shown a long-term efficacy, meaning that we haven't seen how well it can potentially last for a long period of time. But then most importantly, it also has some further risks that are associated with it. So you can have sensory loss, you can have differentiation in the pain. All these things can be problematic and an issue. So when we talk about this study that looks at dorsal root ganglion stimulation, What is dorsal root ganglion stimulation? What it is the following. It's a different type of spinal cord stimulator that instead of it being placed in the epidural space, is frequently found in the epidural space initially, and then it comes out onto the nerve root, which gives a different property than what otherwise would be present. It has a greater efficacy. It's able to be targeted specifically to that spot, and the success rate is also greater. So when we look at the nerves that normally are targeted specifically for the areas of hernia, what we see is that traditionally the treatment of the L1 and S2 regions can be able to provide a significant amount of relief because it's covering a number of these different nerves that are listed here that we just talked about before. The upside is that it doesn't damage those nerves so that you don't have any sequelae like you would traditionally have if you did a surgical response. And because it's an implantable technique, it can be able to provide relief that can be sustainable for quite some time. So when we take a look at hernia surgery as a whole is done in about 20 million people overall. And that mention of that 14 to 16% end up resulting in postoperative pain that can be significant, sustainable, and we need to find ways to be able to try to deal with it and address it. So we look at DRG stimulation from a paper almost about 10 years old now. What we found is that patients were able to get sustainable relief that decreased the pain by at least 71%, which is a pretty significant impact. At the end of the day, we want to know, are there options that not only work, but help us improve the quality of life and let us be able to get back to doing the things that we want to be able to do? And this particular treatment is a possible option for some people to be able to do that very thing. If you found this video helpful, please hit the like button and let us know what we're doing right. And if there's some things that we could do better, let us know that too. If you want to know about other therapies like this or other treatment options or risk factors or how certain surgeries can cause certain problems and we need to kind of figure out how we can be able to address that, please hit the subscribe button and the bell so that way you can get notified about new videos that are coming out and be able to see how it can help you or someone that you care about. Thank you so much and have a great day.